Today we will be looking at the superior colliculus and its role in automatic orienting. The superior colliculus is one of two dorsal midbrain structures. It allows for movement and orientation of the eyes towards large and moving objects in your peripheral vision, so that the object falls into the center of your vision instead. It also allows you to move your visual focus from one position to another. These eye movements that allow you to move your visual focus are called saccades, and there are two kinds: express saccades and regular saccades. Express saccades tend to be more reflexive. They are triggered by visual stimuli in your peripheral vision that are new. When the superior colliculus is damaged, these saccades are extinguished. The other kind of saccade is called a regular saccade. These take longer and can be driven by important outside stimuli or just voluntary control. When needed, the superior colliculus will act independently when there's an important enough stimulus. Here's an example to consider. You are in a situation where you're driving on a dark road during a thunderstorm. There is a bright flash of lightning. In this situation, your superior colliculus will help you automatically orient your eyes and your attention to that flash. However, your frontal eye fields will have to keep your eyes on the road. There are three distinct layers to the superior colliculus. The most superficial layer contains neurons that respond quickly to the onset, offset, and motion of visual stimuli. The intermediate and deep layers contain neurons that are sensitive to both orienting movements and sensory characteristics. Now let's take a look at a condition called supranuclear palsy. This condition arises from the degradation of the basal ganglia and the superior colliculus. These patients often behave as if they are blind, even when their eyes work perfectly fine. They don't turn towards people or look at the food on their plate. In the lab, these patients have trouble moving their attention from one point in space to another. Here is a neuroimaging study showing the tau ligand binding patterns in progressive supranuclear palsy. Other neuroimaging studies on these patients have shown that the greater the stimulus's ability to capture their attention, the greater the activity levels are in the superior colliculus. Thanks for watching. We hope you learned a little bit about the superior colliculus and its role in automatic orienting.